You're watching CTOM TV. Knowledge is power.
Now we have a question from Aaron. What changes should I make in my lifestyle during my cancer care?
Definitely exercise and diet.
So what kind of exercise, what kind of diet?
So physical exercise, you want to hire a personal trainer. You definitely want to hire a personal trainer because if you have bone metastasis, you don't want to be pushing things too hard. And you want someone who has experience with exercise and so you don't get injured.
Got it.
Exercise is really important for a variety of reasons. Number one, angiogenesis, which is the process where tumor cells recruit blood vessels. That is a faulty process, and it produces leaky blood vessels compared to neogenesis, which is the normal version of blood vessel development.
But they do that because that's how they feed, is it not?
Yeah, so they want a slightly leaky blood vessel so they can spread and go through tissues and so on and gain more metabolic resources. So exercise helps by reducing the proteins that are involved in angiogenesis. And that's because the muscle requires more blood supply and is stealing all of those resources so it can develop blood vessels for the working muscle.
So it slows.
It's slow. Yeah, it's a competition for resources. So building muscle is what we call a metabolic competitive inhibitor of cancer.
Metabolic competitive inhibitor.
Yes, or competitive metabolic inhibitor of cancer. Because they're a very similar process, building muscle and cancer cells growing. They both require stem cells. And that's another resource that is stolen by the working muscle, is it takes away some of the growth factors that cancer cells thrive on.
Some of those hormones.
Yeah, the hormones and the growth factors, the natural steroids. Additionally, contracting muscles produce some anti-cancer proteins, cytokines and interleukins and so on that actually inhibit tumor progression. And then finally, exercise gets the lymphatic fluid moving. Now, as you know, we have a system of vessels called the lymphatic vessel, and it's very similar to the blood vessel system, but it also has these nodules in it that contain immune cells. And so when our body's fighting cancers or disease, the breakdown products are passed through the lymphatic system, including the cancer cells. And so cancer cells can use the lymphatic system to travel. And so the immune cells are located in the lymph nodes, which are, every short distance, every inch or two throughout the lymphatic system. And the cancer cells can get stuck in there because lymphatic fluid is like molasses. It doesn't flow very quickly. And the only way to get that moving quicker, so these cancer cells in the lymphatic system get exposure to the immune cells that are going to attack them, is through exercise. So and really, once again, it's this theme of keeping everything moving.
Keeping all the flow.
Yeah, keeping the blood flowing.
And what kind of exercise?
Right now, it's resistance exercise. So that could be weightlifting.
Or things like squats and push-ups.
Any sort of resistance
my own
exercise.
Body weight.
Anything that uses muscle.
Anything that uses muscle. So not so much, obviously running uses muscle, but you would want to add some
you would want to
weights.
do uphill running.
Right.
Yeah, something that really stresses the body more and really makes your muscles sore. I also remember watching a video when I was first studying biology many, many years ago, and it was this image of a blood vessel. And it showed it was a live video of a blood vessel, an electron microscope maybe. And it had these, the blood was flowing through it, and it had all these immune cells and so on. And you could see the immune cells moving through the blood. And then it had a cancer cell, and this cancer cell was hiding in this little divot in the wall of the blood vessel. And it was kind of like a back eddy. And, so the blood was flowing down this way, and there's this little divot in the blood vessel, and the cancer cell was sitting there. And the immune cells were flowing back and forth, and they couldn't see that cancer cell. And so then what they did was they increased the blood flow, and it created a little back eddy that popped the cancer cell out into the main flow of the blood vessel. And immediately all the macrophages and immune cells just jumped on this cancer cell and devoured it instantly. And I was really impressed by that.
That's
it really made
the memory
chord.
burn.
Yes, like, ooh.
exercise.
Exercise, yes.
Mhm.
Yes.
Hmm. And what about diet? The question was, what changes should I make in lifestyle?
Well, I think overall, the trends in cancer diets are following longevity diets.
Mm-hmm.
And
the restriction, like
the
5
dietary,
and 2,
yeah,
or what is it?
yeah, the dietary restriction is an important thing. You know, you want to have less calories as you get older,
Mm-hmm.
and that's because the metabolic process is really hard on your body.
Mm.
And you want to have foods that are easy to digest, but you also want to have a lot of plant-based foods.
Mm.
You know, less meats. And the theory is that once everyone reaches 50 years old, they should all switch to a mostly vegetarian diet. Now, not entirely.
Mm-hmm.
You do need some meat. There's essential amino acids, and it's a great source of nutrients. But really, it's high-calorie food, and it's pretty taxing on the system. So you want to have a mostly plant-based diet.
Okay, so lower your calories
Yeah.
and mostly plant-based, especially over 50.
And variety is key.
Mhm.
You want to have as many different types of plant-based foods as you can.
Mm. And is that just kind of like the shotgun effect? You're just trying to make sure you cover all your bases, or what's the value of the variety?
Yeah, it's a bit of a shotgun effect, I would
Mhm.
say. Yeah, it's a good way of looking at it.
Okay. Doesn't hurt, right, to cover all your bases, especially when we're talking about cancer prevention, for sure.
Well, there's
cancer
so
care.
many plant phytochemicals that have a very small but significant impact on specific signaling pathways. And since cancer cells are so complex in their molecular signaling, and there's going to be so much heterogeneity and variation between the different cells and their signaling, the more plant phytochemicals you have, the more variation, the higher the chances are you're going to have one of those plant phytochemicals that will affect a specific signaling pathway.
Right, that makes sense. One other thing that you haven't mentioned yet in response to this question, just in case you forgot, we're talking about changes that would be a good idea to make in one's lifestyle during their cancer care. And we've talked about exercise, the purpose of that, and diet. But there's something else, which is knowing the genetics.
Of course,
particularly if you have any inherited mutations, certain foods or even certain types of treatment will be better or worse for you, or more important for you to have or more important for you to avoid than perhaps the person sitting next to you in the waiting room. So understanding what's going on molecularly, if that's the right word, in the body is important too.
Very, very important. We're going to get into that with our colon cancer talk.
Okay, so stay tuned on that. Okay, thanks very much, Erin. Great question.
Thank you for watching Cetome TV. Subscribe below and stay informed.